Mutual aid is just a term to describe what our communities and ancestors have done forever of, keeping each other alive. So COVID-19 mutual aid, it started in March when, COVID first hit Seattle. Some of us in community are part of a group called Parasol, Pacific Rim Solidarity Network. And we do solidarity work with folks in Asia, specifically in China. And so at that time, we were already learning about how folks in Hong Kong and China in particular had been organizing mutual aid. And so it just made sense then for us to let's organize mutual aid here. And specifically just thinking about individualistic, neoliberal public health and us not wanting to have a version of that and wanting to think of public health as some, a collective endeavor, collective health, focusing on folks who are most impacted, marginalized, and thinking about how we can have an abolitionist kind of working class response, public health response to COVID that's different from what the US government or, any of these neoliberal public health institutions were putting out.
It was very much so like a network of folks recognizing and a network of communities recognizing that we needed to come together in some way. And I think that's, if you're thinking about organizing philosophies, I guess that maybe the best way is to describe it is that we are communities and individuals coming together, knowing that our collective care and well-being is based in one another.
Whether it's a weather event or a pandemic, the most vulnerable and marginalized among us are the ones that suffer the most. So for that reason, this mutual aid network has been focused on working towards collective well-being through a class solidarity, disability justice, anti-racist lens. And like all mutual aid networks, it's about organizing, yes, but also pushing back against those systems and institutions that cause the vulnerabilities and marginalizations to begin with. And at the same time, working to build alternative systems and institutions in its place.
People aren't in touch with our communities, people in power, people who are making decisions and who are allocating resources don't know what people need. Most of our population is seniors. Some of them are families who have lost their jobs, but what they're getting, from nonprofits and whoever else who's trying to help them are canned goods, boxed goods, things that they can't eat because they don't eat Western food. And they were never asked what they needed. And it's just food that mostly goes to waste. So it's a lot of resources that aren't getting distributed well. People aren't able to eat healthy. It's not culturally relevant. So we're seeing that there's a lot that could be done that people have not been doing historically.
There is so much money going into all these systems that has failed us for centuries, and then but no money coming towards basic care for our communities, right? Whether it be housing, food, water, all these things, we are scrambling,
especially undocumented communities who are not being served at all by the state.
That is a big motivation. It was a big motivation behind the community pantry in Burien, recognizing that undocumented folks couldn't access the traditional emergency food systems in the county. There were barriers to access food banks. Some of them were staffed by law enforcement or National Guard, which was intimidating visually. Some of the food banks and pantries would ask for identification, which was a barrier as well. So that was a massive motivation for these community food pantries as well. We're imagining a food system that's defined by our communities, one that's built on cooperative ownership, ecologically and environmentally sustainable farming methods, a food system that values food providers, provides knowledge and skills, localizes food production, and ultimately provides our communities with culturally relevant, life-sustaining food.
The change that we imagine is really just people who are working in DOC treating incarcerated individuals like the actual human beings that they are, and not treating them like caged animals. So, and that would extend to jail populations. That's not just prison systems, that's jail populations, that's ICE detention centers. Like, these are human beings that are in these buildings. And in order to see any real change, I just need to see them treated like human beings and afforded the same respect as any other human being would be afforded.
It's both really tragic that these institutions that have all the resources, all the power, are not serving us. It's a moment of upheaval, but it's also this time where I think we can really, we're being pushed to like keep each other safe.
For me, I really look at like the Three Sisters, like planting philosophy, and there's like this really beautiful like interconnection of like roles within that Three Sisters like planting method. And I really see that as like a great metaphor for like our organizing philosophy and approach. Like, we each play a different role, we each have different strengths and weaknesses, and we can receive benefits from others and we can give benefits to other folks too. Like, we're able to really just play off each other really well. And I think that really highlights like the mutual aid approach too, because it is horizontal, it is reciprocal. There is like no hierarchy in how we are able to receive and disseminate benefits to each other.
I think a big part of our work is relational, non-transactional, and really trying to avoid this service model of philanthropy. You know, we're really not trying to be a charity. We're not trying to be a nonprofit. It's really people in community who are stepping up to do the stuff, to do what needs to be done. And then when we have to pass it on, we pass it on. And that's also why so much of it is low barrier, of like just operating on trust and just operating that people will ask for what they need. And if they don't, they'll pass it on.